association and causation. What is association? What is causation? We will discuss when association becomes causation. We'll discuss what is association. We'll discuss this session according to following learning objectives, like we'll discuss the definition of association causation. We will discuss various types of association, like spurious association. There is indirect association. There is direct association. And then we'll discuss Hill's criteria. Then we'll summarize the session. So let's start with the definition. What is association and causation? Association. We use this word commonly. Association of smoking and lung cancer. Association of malnutrition and tuberculosis. Precise definition will be occurrence of two variables more than often is called association. When two variables occur more than often, like smoking and lung cancer, they occur more than often. This is called association of smoking and lung cancer. So we can write occurrence. Occurrence of what? Two variables. More than often. Is called association. So we can give example of smoking and lung cancer. Smoking causes lung cancer. This association is consistent. When association becomes strong, it becomes causation. When association becomes strong, it depends on correlation. Correlation is from +1 till -1. So there is, if correlation is +1, there is positive association. If it is 0, there is no association. And if it is -1, there is negative association. Like if correlation of smoking and lung cancer is 1, this is positive association or causation. If it is 0, there is no association between smoking and lung cancer. If it is -1, there is negative association. So we can give example of cause, like Mycobacterium tuberculosis causes tuberculosis. Tuberculosis is caused by Mycobacterium. In the absence of Mycobacterium, there is no tuberculosis. This is cause. This is exact cause. We can define it, that a factor without which disease process can't occur is called cause. So we can write Mycobacterium causes TB. So there are 3 types of association: spurious association, indirect association, and direct association. What is spurious association? Name indicates this is artificial association. What is indirect? There must be some confounding factor or indirect factor. And what is direct? That is due to direct cause, like Mycobacterium and TB, Salmonella and typhoid. Let's discuss them one by one. Spurious association, wrong association. Like we can give example of coronavirus and deaths in hospitals. People who visit hospital or who are admitted in hospital due to coronavirus, in them death rate is higher or mortality is higher as compared with those cases who stay at home. This is spurious association because we don't know the underground causes. People who visit hospital with coronavirus may visit due to complications. That's why death rate is higher. And those who stay at home can have minor disease. So we can't establish association on the base of just one fact. We need to know the background. We need to know about the complications. And there is other example. Perinatal mortality was greater in UK in a study in hospital rather than in home. So people may assume that hospital is a dangerous place or deaths are more in hospital. But cases who visit hospital may visit due to complications. So we know the background, we should know the facts and figures. So we can give example of Spurious Association, COVID, and hospital. Or perinatal mortality. Spurious Association may misguide for intervention, may misguide for planning. So before making the plan, you should know all the facts related with disease, all the facts related with patients, why people are admitted in hospital, why they stay at home. There are mild symptoms, there are moderate symptoms, there are severe symptoms. So we should have an idea regarding natural history of disease, regarding severity of disease, regarding complications of disease. So we should know natural history, severity, and complications. An indirect association. There must be a confounding factor. It is observed that goiter is common in hilly areas. So goiter and hilly area. There is an association between goiter and hilly area. But cause of goiter is iodine deficiency. So hilly area is confounding factor. What is confounding factor? A factor which may affect the outcome of study is confounding factor. Goiter is not due to hilly area. Goiter is due to iodine deficiency. People who are living in hilly areas use less iodine, or iodine is not present in water. So this is indirect association. Confounding factor affects this. Then there is direct association. Direct association has two types: one-on-one and multifactorial. As the name indicates, if a disease have one etiology, it is one-on-one, causal relationship or association. If a disease has multiple etiologies, it is multifactorial. So let's discuss one-on-one. Like Salmonella typhi causes typhoid fever. This is cause of typhoid fever or exact cause of typhoid fever. For a person to develop typhoid fever, entry or presence of Salmonella typhi is mandatory. This is single cause, single etiology, or paramyxovirus causes measles. This is single relationship, single etiology. Without paramyxovirus or without invasion of paramyxovirus, measles doesn't occur, or measles is absent with paramyxovirus. This is single relationship or single association. Then there is multifactorial. What is multifactorial association? As the name indicates that multiple factors are involved in disease process. So disease has multiple etiologies or multiple causes. That happens in case of chronic diseases. Chronic diseases has multiple etiologies, like we can give example of ischemic heart disease. Ischemic heart disease can be caused by hypertension. It can be caused by diabetes. It can be caused by stress. It can be caused by high levels of cholesterol. All these factors combine and cause a disease, or all the factors can independently cause the disease. This is multifactorial with multiple etiologies. You can remember the example of ischemic heart disease or multifactorial association. Now, we will discuss Hill's criteria. When association becomes causation, or this is additional criteria of strength. What is Hill's criteria? Additional criteria. Additional criteria of judging causality. So we judge causality by applying Hill's criteria or Bradford-Hill's criteria, or this is called additional criteria for judging causality. There are various steps involved in Hill's criteria, like temporal association, and strength of association. Association must have strength. Then specificity of association. Then consistency. It should be consistent. Then biological plausibility. There must be biological changes. Then there is coherence of association. So we judge or we check Hill's criteria by applying these steps. Number 1, temporal association, strength of association. Number 3, specificity. Number 4, consistency. Number 5, biological plausibility. And number 6, coherence. This is a common university question. What is additional criteria of judging causality? So we discuss the steps one by one. What is temporal association? When there is risk factor, it proceeds toward disease or towards outcome. Or when risk factor is present in the body or risk factor invades, disease process starts temporarily. This is temporal association, like risk is smoking, outcome or disease will be lung cancer. Smoking can't cause lung cancer within a day. It may take time. It takes time. Higher dose is required. But when smoking starts, disease process starts or initiates, this is called temporal association between smoking and lung cancer. For chronic diseases, it is of longer duration. Then, strength of association. How we judge the strength of association? Association must be strong. We check it by dose. Like, dose of smoking should be higher, 20 to 30 cigarettes. Then, duration. And depends on duration. 20 years. Then, it depends on relative risk. It should be greater than 1. Then we can say that there is positive association between smoking and lung cancer. To develop lung cancer, smoking of 20 to 30 cigarettes per day for more than 20 years is required. When we analyze, relative risk must be greater than 1, as we analyze it in cohort studies. We analyze relative risk in cohort studies. What is relative risk? It is a ratio between incidence of exposed and non-exposed. So, there is initiation, there is dose, there is duration, there is greater relative risk. Then, association must be specific. Like smoking should cause lung cancer, its percentage should be greater. We see the specificity by attributable risk. It is expressed in percentage. Like if smoking causes lung cancer, we'll see attributable risk. How much lung cancer is caused by smoking in a smoker? That is attributable risk. Like if our answer is 80%, we can say that smoking is 80% responsible for development of lung cancer in this smoker in our study. There may be other factors. There are other factors like aging. There are genetic factors, there are environmental factors. So we have to see the specificity. We check the specificity by attributable risk. Then association must be consistent. We do a study in Pakistan, we do a study in America, or we do a study in various parts of Pakistan about smoking and lung cancer. Answer should be same. Smoking causes lung cancer. There should be association between smoking and lung cancer. So it should be consistent. Consistent in various places. Consistent in various populations. Don't get confused with various population. Various population means that all populations of smokers, but at various places. Like people of Sindh, this is a population. People of Punjab, this is a population. But smoker people of Sindh and smokers of Punjab, we see them. Then there is biological plausibility. There are biological changes in the body. Like epithelium changes in smokers. It changes from stratified to columnar epithelium. Stratified to columnar. Then there are changes in lungs. Changes functioning, structure of lungs. Then it can cause lung cancer. Without biological changes in the body, disease process is not present or disease is not present. So it causes changes. These changes will lead to disease. Then there must be coherence. What is coherence? Traditional evidence, historical evidence. History should reveal that smoking causes lung cancer. There should be historical evidence. Like studies conducted 100 years before showed that smoking causes lung cancer. Studies conducted in 2021 show that smoking causes lung cancer. So we will summarize this. We have discussed association and causation. And causation. We must remember the definition. Occurrence of two variables more than often is association. When association becomes causation, it depends on correlation. It depends that correlation should be 1. When it becomes causation, due to correlation. You must remember, for positive association, correlation should be positive 1. 0 indicates no association. -1 indicates that negative association. Then we discussed various types of association. This is a common university question. There are three types: spurious, indirect, and direct. We discussed them various examples. For spurious association, COVID and admission in hospital or mortality, indirect goiter and hilariae, direct mycobacterium and TB. Then we discussed additional criteria, Hill's criteria. Hill's criteria is frequently asked in university. You can remember this by this flowchart like risk, causes, outcome, or disease. For this risk to cause this disease, there are various steps. What are various steps? Temporal association, strength, it should be strong. Dose should be strong. Duration should be greater or longer. Relative risk should be greater than 1. Then there is specificity. This factor should be specific. We discuss in percentage. We discuss that attributable risk shows specificity. Greater attributable risk shows greater specificity. Then we discuss consistency. It should be consistent. Then we discuss biological plausibility. There are biological changes. Then we discuss coherence. There is traditional evidence or historical evidence. You can summarize Hill's criteria by this. That's all.